be at our milestone of 2,500 beyond. So thank you very much for joining. I would like to communicate my sincere thanks with gratitude to Madam Kamini Dhimanji. Madam Kamini Dhimanji has given us blessings to conduct this webinar series, two webinar series actually, not only one, but two webinar series has guided by continuous from last so many years, and she is best coordinator, orator. So I'm really thankful to her that she has blessed us like anything for the webinar series. She is out of India, abroad, then also she is coordinating. So at 2,574th milestone in 5 years and 907 plus in recent 365 days. Thank you for your overwhelming support. I would like to communicate my regards to Professor Himanji from All India Institute, New Delhi. She has been there as professor and head. Dr. Nanda K.O., and Professor, Department of PG Studies in Trirog, JSS Ayurved Medical College and Hospital, Mysuru. So welcome both the coordinator, and I am really welcoming you to join every day because we are conducting every day 3 webinars. So I'm requesting you to consider the time limit of 45 minutes. Then we can again for half an hour for question and answer session. So wind up this webinar within 9:15. Then our second webinar is on Varsha Ritu Charya, and third webinar is on Charak Jayanti celebration. So please do join. Please stay with us for different topics and subjects. I'd like to welcome Professor Kamini Dhimanji, stage coordination, and her welcome and blessings.
Namaskar, Pavan sir. Namaskar to all whosoever join over here, all the experts, all the practitioners. Some of the scholars also have joined today, and our regular participants. In the series of infertility, today we are having a guest speaker, Dr. Nanda. She is having experience in treating infertility cases since long. So we decided to invite her regarding the case series to discuss some her experiences to this platform. Already we have discussed some theoretical aspects, some positive factors also. So according to the case presented and according to her presentation, we will have discussions after her presentation. So directly, I would like to invite Dr. Nanda for her presentation. Dr. Nanda, over to you.
Thank you. Om Gurupyo Namaha Ajnanatimmirandasya Gnananjanashalakaya Chakshrimilitam Ena Tasmai Shri Gurave Namaha. Most respected Dr. Pavan Sharma sir, convener and the host of the Interdisciplinary Institute of Research, Education and Skill, and Dr. Kamini Dhiman ma'am, professor, for inviting me for this Ayurveda AYUSH Samriddhi. And I also thank my guide, Dr. Gayatri Bhatt Madam from SDM Ayurveda Medical College for giving me this opportunity. Is going with, first let me share my screen. Yes. Going with today's topic, like Vandyatva, a clinical perspective, like, can it be visible? Yes. Going with the topic proper, like Vandyatva, when we go with the word, like, yes, we know like Stri Moolam Apatyanam, Stri Rakshati Rakshitaha. Indeed, we protect Stri, she indeed protects progeny or offspring or a future generation and our family. In this regard, we need to like existence of the human race revolves around the woman, right? In this regard, like where Janani, the word given to her like Janani, only because she is the one who is having a power to give a new life to the universe. And in other word, where Vandya, it is referring a woman who has hindrance for any kind in the normal process of conception. In this regard, she may end up with she may feel like social stigma, or even she may feel like a curse for herself, and she loses her name and faith and belief in her family and being a barren. So in this regard, fertility is mainly like nowadays when we think of, it's mainly under the influence of like lifestyle and the environmental factors that impact her reproductive system and above all our hormonal and the gamete health. In this regard, today I'll be going further, just give a brief note what is the prevalence of it. Yes, infertility is ranges from 13.3 to 15% of it and worldwide. And when we go in specific, like estimated to be 8 to 10% of couples worldwide having suffering with significant burden of infertility. And when we go with the developing countries like India, where in every four couples where one will be suffering with infertility. That is the like global infertility prevalence, and what presently in India, developing country, we are suffering with one in four couples. And going further on, like incidence of female infertility is definitely both male and a female are both equally contributing, and there are like combined factors and unexplained and iatrogenic. And going furthermore, where ovarian factor, when we consider, it is around 25% contributing, and the tubal is around 30%, uterine factor is around 3%, and cervical is around 5 to 6%. In this regard, after knowing the incidence, we need to know it like naryaha santanam cha jayate iti vandyaha. A woman is unable to conceive, she is referred as vandyatva. And vandyata is the condition where there is a failure of conception due to defect in some garbha sambhava samagri, maybe rutu kshetra, ambu, or bija. And even Harita says, if the woman not only fails to conceive, this is the one thing we need to think over. In olden days, we have a concept who is unable to achieve a live child or to be getting a child, we consider even her as a Vandyatva. Where in modern we say primary or a secondary infertility. In this regard, in broader sense, we can understand what exactly the word meaning according to Harita, the Vandyatva. And according to WHO, infertility is inability to conceive the pregnancy after having an unprotected sexual intercourse with average frequency of 3 to 4 times per week of any without having any birth control measures. Yes, and furthermore, like types apraja, sapraja, and vandyatva, where Apraja not even unable to conceive even for the first time or not even having a single child, we consider as Apraja, and Sapraja, where they will be having one child and the next consecutive pregnancy they will be hampering. And Vandya, where the congenital or a congenital malformation hindrance for achievement of conception. And Harita, yes, widely he gives importance where primary and the secondary infertility together, he says Kakavandya can be understood as primary infertility where they couldn't able to achieve once also. And Anapatya, one child and followed by the next consecutive pregnancy is hampering. And even not getting a live child can also be considered under the heading of Garbhasravi, Mritavatsa, and Balaksha, because the nutritive or the strength of the woman, maybe in the reproductive health, that is also have need to be considered, or any trauma, garbhakosha bhaga or dhatukshaya may be leading to the condition of infertility. And there are other contexts where adivandya, like congenitally they are impaired of fertility and dosha based, and then bhutaja or daiva, where unexplained infertility we can understand under that category, and raktaja and abhicharaja. These are all few broader headings we can understand the present scenario, what are all the causative factors ending with infertility. And definitely when we understand the version like Yoni doshat manaso abhitapat shukra asrig ahara vihara doshat akala yogat balasangshayacha garbham chirad vindanti saprajapi. In the context of sapraja, where we get a reference is that what are all the causative factors in broader sense we can understand. Prior to that, there are majorly the factors essential for achievement of a pregnancy or a fertility is Ritu Kshetra, Ambu, Bija, and Anila, Manasika factor, Ahara, Vihara, and Daiva. Why I'm saying is nowadays, whatever we say, lifestyle or stress related, everything has been beautifully explained, the considering the factors which is essential for achievement of conception. And going with Yoni Doshat, yes, Yoni Doshat, we can understand in the broader sense, maybe any reproductive system diseases like maybe Yoni vapors, or because whenever the Yoni vapors are there, the Garbham na Vindanti. Because the primary cause may be a like Yoni vapor, the consequence being end up with infertility that we need to analyze based on proper history, examination, and relevant investigation. And going further on with Artavavaha Srotas, where Artavavaha Srotas with the Lakshana, where we have there Artavave Dve Tayor Moolam Garbhashaya Artavayani Damanishta Tatra Vidhayam. That is a version. He directly says maybe extrinsic features also may trauma may end up with Vandyatva, Maithuna, Asahishnuta, and Artavanasha. That is also one of the contributing factor ending with infertility. And even Yoni Arshas, okay, in that context also we come across the condition that is they say yonim upahanti artavamcha, that whenever the yoni ashes is there, that destruct the artava also. And baga sankocha, there are some other thing in relation to yoni pradoshat we can consider, that is end up with anapatya, that is the lady couldn't able to conceive if she end up with yoni pradoshat. And manaso abhitapat, as we all know, like saumanasyam garbhakaranam shreshtam, and achievement of conception is solemnly based on even though every factors are normal, but even the psychological factors is not optimum, then definitely it interferes with infertility. Keeping that note, they say, and even maithuna contraindication when they're going, if she is having shoka, baya, bibats, and some other thing, where psychological factor during conception, that is also equally important for achievement of conception. And asrik doshas, I already said about Artava doshas and Ahara Vihara doshas. In this context, you can consider like healthy food habits and other thing, or Ashana, like food, nature of food, what kind of food they are taking, and appropriate matra of it, and the balanced diet. Everything will come under the category of Ahara dosha and Vihara dosha. Maybe in relation to Yoni Vapath, when we look into that, like Vega Vidharanath, or maybe in relation to Apadravya Sevanas, all those things we can understand in the context of Vihara Dosha. And Akala Yogat, Akala, if at all not timely achievement of conception, especially in the fertile period, that can be understood as maybe in the Rutukala, if the conception, they are not tried for conception, or maybe like via proper age of attainment of conception, or maybe Shubha or Ashubhadina Nakshatra Titi, all those things what we believe in our science, that may be considered as Akala Yoga. And Bala Samshayat, because the physical entity should be strong enough to sustain the pregnancy changes and other thing and achievement of conception, that comes as Bala Samshayat. This is the in broader sense. Now whatever the categorization we do it nowadays, maybe in relation to the infertility causes, that can be understood this beautiful quotation of Charakasharina. And going furthermore, understanding of Vandyatva and infertility in present, this thing like Bija Dushti, whatever like ovulatory disorders or poor egg or sperm quality, both male or female factor, and Artavakshaya or Artavadushti can be understood as anovulatory or hormonal imbalance, because based on this, I'll be giving a discussion on their management. And Srotoroda, or a blockage of channels or other thing in a broader sense, you can understand like tubal blocks. Okay, then the cervical mucus issues where the penetration or pool of sperm in the vaginal pool where the cannot be possible to sustain, that can be understood. And kshetra dushti, where anatomical derangement at the level of uterus anomalies, or maybe at the level of endometrial dysfunction, can also be understood as kshetra dushti. And shukra artava ashuddhi, or impairment leading to the genetic or ineffective causes for impairment of or achievement of conception. And Rutu Asatnya already said like irregular cycles or luteal phase defect, where at the endometrial like implantation, the defect may end up with leading to condition called as infertility. And going further in females in a broader sense, I already said ovulatory factors, how much it's contributing. Even then, PCOD or amenorrhea or premature ovarian insufficiency, majorly among 40%, it will be end up with maybe a PCOD or ovarian cyst and other thing. In the consecutive slides, I'll be explaining on the approach towards the PCOD and other thing. And the tubal factor at the level like tubal block, hydrosalpinx are the more commonest one. And post-surgical adhesions or anything, if the lady would have been undertaken, that would have been the leading cause of infertility. And the uterine factor, maybe except congenital like anomalies, septa and other thing, even the fibroid is nowadays raising like anything, and along with endometriosis and then chronic endometritis, because I have one successful story of endometritis that I'll be highlighting in the next consecutive slides. And the cervical factor, even beyond all the factors like ovarian and other things are good enough, but there is where suppose cervical mucus or cervical infections or cervical stenosis or cervical polyp, that may be also one of the thing where the penetration is not at all happening, where the impairment is at the level of entry itself. Or there are some other factors. Unexplained infertility is also having a higher rate of 10 to 15% contributing, and even the lifestyle thing may end up with stress or maybe obesity or pure nutrition, and the lifestyle like smoking and alcohol also equally contributing nowadays for achievement of conception. Same in relation to the males, maybe a pre-testicular cause or testicular cause, post-testicular cause or a sperm abnormalities or immunological causes, lifestyle, environmental factors and iatrogenic. Why I'm telling in the headlines is definitely nowadays whatever like pre-testicular, post-testicular, the living that nowadays it becoming more this thing that exact cause will be unknown, obscure. So in a broader sense, we classify and we understand our treatment will be easier. And going furthermore, like prior going to the treatment as such, proper evaluation based on the history, examination, starting in a simple general physical examination, systemic and specific gynecological examination is a guiding force or a path towards or a lighting towards the achievement of treatment. And proper investigation, maybe from the basic investigation tool on the endocrinal factors or maybe ovarian factor, depending on that. First and foremost thing is basic investigation, and later simple ovarian factor we will be confirming whether anovulatory cycles and other thing based on the investigations, and later with the tubal factors evidently, and even then like if associated with uterine or a cervical factor, because the infertility may be existing with a single factor or maybe multiple factor, maybe in a single partner or maybe with the couples it may be there multifactorial. Based on that proper history examination and relevant investigation, we can screen them and we can plan according to the appropriate management. In this regard, as we all know, like chikitsa three siddhantas like maybe yukti vipashraya, sattva vipashraya and daiva vipashraya. Based on that, first and foremost thing is always nidana parivarchana is the main thing. Proper evaluation, in that only will come to know maximum what all the nidana's causative factors, maybe at the level of basic life modalities, maybe their biological clock or water intake or maintaining the hydration. Yes, basic thing from that itself, if we corrected, the achievement of conception or achievement of the success of treatment is there at the level of nidana parivarjana itself. And going with proper evaluation where yoni vapaths is there pre-existing with that primary cause, if we treat it, then that achievement of success will be, result will be more. And samanya chikitsa, where we consider that samanya as whoever seeking for fertility, then going with in accordance with garbhadana samskara or preconception care, irrespective whether they are seeking for fertility or what. Why? Because Ayurveda always thinks on achievement of Shreyasi Praja. In this regard, even though they are not suffering with any disease or disabilities, but proper, if at all, always Ayurveda speaks on planned pregnancies rather than by chance, because all pregnancy should be by choice and it should be well planned. In this regard, garbhadhana samskara is having its own importance that I'll be highlighting. And furthermore, like going with shodhana chikitsa, importance of it, how exactly it is helping, and sthanika chikitsa wherever, where and when it's required, and going with some few shamanaushadis, and going with, because patye sati gadarthasya kim aushadam nishevanat, patye asati gadarthasya kim aushadam nishevanat. Definitely adaptability of patya and apatya in the treatment is the success key for any success of the treatment. Okay, in this regard, going with the sthanika chikitsa as the first and foremost thing, like based on the yukti, like maybe in relation to the specific conditions, if she is suffering with any yoni vapaths or something like that, based on the requirement, we may plan maybe yoni abhyanga, yoni dupana, yoni prakshana, or kalka prayoga, yoni pichu, varti, uttarabasti. Depending on the requirement, we may plan the treatment. Okay, this is in relation to like how we need to go with the management, because vaginal pool is the main thing where it absorbs majorly, and because of levophilic action of the drugs, it having a target action at the vaginal pool itself, and absorption of that will be more, and it maintains the vaginal pH, and it helping for relieving the infections if anything is there in the door entry or in the entrance itself, in the ascending infections that can be tackled very well in the line of Sthanika Chikitsa, where the local infections and other things are there. This is in general yogas, where maybe in Grita preparation or maybe Thaila or Churna, Kwata, Arishtas, and some medicaments where we can plan it. And some once like Grita, Asava, Arishta were disease specific we had treated, and definitely we need to have a line of treatment with respect to rasayana therapy. Nowadays, what we say antioxidants or vitamins or minerals we speak about. Definitely, these are all rasayana dravyas are very essential because to overcome the what do you call antioxidant like oxidative stress or other thing or endothelial damage or whatever, to overcome that the rasayanas will opt to look after whatever the line of treatment you plan approach you do it. Last and foremost thing is definitely you need to have some rasayana therapies for to tackle the condition from the root. And going furthermore, Daiva Vyapashraya Chikitsa, definitely we have like home god or like Gotra Devis or Durga Mantra. These are the references we get it even from Balatantra, but still Putreshti Yagna and Varana Bhanda, whatever explained in the classical, definitely it has its own positive effects on fertility. And in RGHS, still one study is going on only with the help of Vishnu Sahasranama. One of my junior is doing on the RGHS PhD in dissertation, where only through Vishnu Sahasranama where the achievement of conception is happening. But she is still on the process of getting, but still she claimed that 3 to 4 cases are success only with Daiva Vipashya Chikitsa. But still, that need to be observed, and we need to evidence-based thing we need to learn on it. So Daiva Vipashya Chikitsa is also equally important for achievement of conception. And going furthermore, Satvavajaya, yes, no couple is born with infertility, but it's all uh, depending on how we counsel and we assure the couple so that sattva is at optimum, then they can conquer anything, even physical entity also. Keeping that, and in also in regard to that, counseling is required regarding the reproduction mode of life and eating habits, de-addiction, and we need to educate the couple regarding like fertility period and what exactly it is. These are all the things need to be aware for the couple. And then dinacharya, and then rutucharya and sadvrita, and then because next session is on rutucharya or related to rutu, this thing, definitely adopting those things, because olden days they have a concept according to the season we need to change our bodily environment. Accordingly, if we adopt that suitable environment, definitely achievement of conception will be easier. And definitely a stress, everyone says stress is the major thing, but tackling that stress, definitely it is a skill and it needs meditation and pranayama and yogasanas to nurture it. And going furthermore, like specific yogasanas as there, and we are having a couple of like setting with the individual disease specific, where it strengthens and relaxes the body and mind and activates the different chakras, and it strengthens the pelvic and abdominal muscles and help for easy attainment of conception. Yes. And going with Patya and Apatya Viharas, like Ahara Vihara, in Patya consideration, Vaikshita Nitya Sevaniya Dravyas and Lashuna, Palandu, Ajamoda, Jiraka, Kulatta, Hingu, even single drug or maybe in combination, maybe in anovulatory, if you think like Ushna Tikshna Dravyas are required, where Patya can also be used in the replacement with Aushadas, where Lashuna, Jiraka, Kulatta, Hingu can be beneficial, and the fruits which is rich in like folate content and folic acids and rich in iron folate thing will definitely help for achievement of conception, and which are micronutrients rich, where green leafy vegetables and other things are equally essential for achievement of conception. And then fertile period vihara, when we consider, that is a counseling regarding the fertility period for the couple, is need of the hour, and proper exercise, especially the maintaining of a BMI, body mass index, is need of the hour nowadays, because obesity is evolving like anything. To tackle that, because proper peripheral aromatization or normal functioning of HPO axis, where we need to have proper exercise and to maintain her BMI. Okay, and going with apatya aharas, like where Suranakanda, Amla Dravyas, Kanjika, Tikshna Dravyas, Adhyashana, Ruksha. See, these are all in general, but still refined sugar, trans fat substances, and red meat. Definitely, where a synthetic estrogen, or maybe in the poultry, red meat, and other things, it's directly impacting our HPA axis where there is variation at estrogen levels and other thing. Definitely, it hampers maybe formation of fibroids, estrogen dependent benign lesions and other thing, and interference with fertility. That is one thing we can evidently proven also. And then alcohol and smoking, vegadharana, prajagarana, and atishtama, vyayama during rutukala. See, these are all to the extent. It doesn't mean that vyayama shouldn't be there. Everything should be at optimum. Anything beyond its limit, definitely it has its own interference with fertility. And going with in general, now we learned about like what is the basic approach and how we need to go with whatever the condition. I can tell you because our acharyas only said naming is not namarupa vijnana of vyadi. When they say it is not that we are not named, it's not that we are not mentioned. Keeping on dosha dosha samurchana, our approach should be there because samprapti vigatana itself is chikitsa. Keeping in that note, going with that, I would say this is the approach how we should go for any infertility, because next consecutively I'll be discussing on cases where approach towards the infertility should be like this. Because nahi vatadrite yoni vapad, like yoni vapad in the context, without vata there wouldn't be any existence of yoni vapad. That at the same time, vayu is yantra tantra daraha. In that context of shloka, he says vayu is the responsible of garbhakriti now. For achievement of garbha formation and achievement is only because of vata. So tackling of vata is need of the art for achievement of conception. And nahi vata, that is the one thing. Yoni vapat for a disease manifestation and for the maintenance of healthy vata, controlling of vata or maintenance of vata, because vata dushti, maybe kshaya or vriddhi shouldn't be happen. Samavastha or maintaining of vata is need of the hour for any treatment modality when it comes to vandyatva. And going furthermore, once vata is tackled, the next question comes as Shuddha Yoni. Because as we all know, like Rutukshetra Ambu Bhija, where fertile land, how it's equally essential in the context, similarly in the context of plantation, similarly for achievement of conception and to get a Shreyasi Praja, Shuddha Yoni is very much important. In this regard, like Evam Shuddhisi Shuddha, Sugarbham Vidnati Yoshita, Adushte Prakrite Bija Jivopakramani Sati. If Shodhana is done, maybe Vamana, Virechana or Basti, depending, or even Nasya, depending on the individual requirement or Dosha Dushya, if we plan it proper Shodhana, then definitely there will be Adrushte Prakrite Bija Jivopakramane Sati. In that, the dosha, maybe Asruk, what do you say? Shukra and Asruk dosha, whatever it is there, that will become Prakrita Adushte, means it will be Prakrita Avastha, and there will be Bija will be Prakrita, and definitely the fertile and Kshetra will be Shuddhi and Jivopakramane Sati. In such individual, Jiva or achievement of or impregnation will happen, and definitely the achievement of conception will be definitive. In this regard, irrespective of the cases of infertility, first make sure that their vata is at optimum level or in samavastha, and later planning on Shuddha Yoni is need of the hour. Depending on Shuddha Yoni doesn't mean only an Virechana or Vamana or whatever. Depending on the requirement, planner, Shodhana Chikitsa, and Garbhadhana Samskara or proper measures, what and all explain starting, because we know that four major life changes or stages of woman: Rajaswala Paricharya, Garbhini Paricharya, and then Sutika Paricharya, and then Rajo Nivritti. This is the four major thing, both anatomically and physiologically. She is going with enormous changes in her bodily changes that need to be tackled very well, so that whatever our acharyas or aptas has mentioned, like Rajaswala Paricharya and then Garbhini and Sutika, if she adopted, okay, that is comes the importance of Garbhadhana Samskara. It is not for infertile, but a planned pregnancy. If we follow that, definitely the achievement of conception. And Pumsavana Karma, it is definitely, I can understand getting a itcha or desired child. It's fine. Sex of a child, that is debatable and definitely a legal issues. But above all, for Garbha Grahanartham and Sthapanartham, for the continuation of pregnancy, because I'll be explaining about the recurrent pregnancy loss, where a Pumsavana Karma definitely help the achievement of conception at the same time, continuation of pregnancy till the expected date. That is what Pumsavana Karma definitely help for it. Keeping that note, adopting Garbhadhana Samskara and Pumsavana Karma, that is Sri Prabhu Sneha Sveda Abhya. Depending on that, maybe Vamana, Virechana, whatever it is, Adi they had mentioned. Depending on that, you adopt it, and then there will be body or the Sharira will become Shuddha. That is what required. And later, specific Samanya Chikitsa of Vandyatva, maybe similar kind of that of Garbhadana Samskara, but specific to the disease. Maybe Yoni Vapat, Artava Dosha, or Yoni Arshas, because I already mentioned what are all the Nidana factors, that is Yoni Pradoshat. Whatever the disease specific, that can be treated, and later you can plan according to the Garbhadana Samskara. First treat the root cause and go accordance with Garbhadana Samskara in later point. And going with Vamana Karma, how exactly it is helping with, in a broader sense, when we think of uterine or an ovarian factor or maybe tubal factor, whatever it is, where Staulya is there or Kafaja Granthi or where Vata Kafa Avarana is there and Prameha or maybe insulin resistance at peak, where Anarthava is persisting, okay, and then Kledya Vyadis, when you think on proper evaluation and a history part, because that is what history relevant history examination and the relevant investigation, you suspect there is an involvement of vata, and definitely avrita vata is there, kafavrita vata, in definitely in such condition, especially in the case of anarthava. I won't say in general, I'm talking about, it's left to the individual consultant, but still, when vamana, when we think of where Anartava, especially in where Agni Bahulyata is there and Rasa Dushti is there, because whatever the line of treatment or Panchakarma you're adopting, it always should be planned on the line of Agni Dushti. Maybe at the level of what do you call Jhatarakni level, or maybe at the level of Datvagni level, you assess it, then accordingly you plan the treatment. If Rasa Dushti is there, Rasa Datvagni itself is hampering, then go with Vamana and later with Virechana, because we know that Uttarottara Dhatu Pariniti, where Rasa Dhatu Dushti is there, then definitely Uttarottara Dhatus or Upadhatu itself is Stanya and Artava. There will be impairment at that level and leading to the further consequences. In this regard, it's not that hard and fast rule, you should plan Vamana itself, but still, in maximum cases where PCOS or Anarthava condition, where majorly where Kapha Bahulyata is there, then Vamana will be opt line of treatment when you're planning for the chikitsa of it. And Vikrita dosha nirharana will happen, and it removes the srota avarodha and sangha avarana of vata and helps in normal functioning of the apana vayu here, especially in relation not only apana vayu, and definitely it helps in normalizing the HPO axis, leading in helping the formation of garbha. But make sure that underlying pathology also should be assessed properly. And going with Virechana is directly mentioned Bijam Bhavati Karmukam Garbhashaya Sruchi. It's the easiest form of adopting a Shodhana, but still it's not that hard and fast will go with Shodhana. Preconceptions do only Virechana. So even you couldn't able to find any morbidity or rasadushti or some other thing, then invariably Virechana will definitely tackle it. But still, where Pitta and Am Pradurbhava is there, then in such condition, Virechana will be the opt and clears the arthavasrotas, detoxifies the uterus and ovaries, and restoration of Agni can be achieved. Any Shodhana for that matter, because Agni, where Agni Mandya is the one of the root cause for any form of diseases that need to be taken care of, and that in turn help for Uttarottara Dhatu Pariniti and even Shukra Dhatu, where Stri Shukra is also equally important, and in turn it helps for HPO axis modulation and normalizes the ovulation and regulates menstruation and prepares the body for her future management, means helping for fertility potential both male and a female. It is not only mentioning Vamana Virechana Basi, it's for couples, okay, that keep it in a note. And going further on with Basti and Uttara Basti, when we context of Anuvasana and even Niruha Basti, where Sthapanartha, and it is specific on Garbhashaya. Why? Because it's Pakvashaya is the sthana of Basti, where definitely whatever, which sorts of thing, depending on Basti, you can plan Brahmana Bastis or maybe Vaitarana Basti or Shodhana Bastis, and even Uttara Basti, you can plan it according to the requirement. And going with Basti specific, especially in Yoni Mapats, another thing, Dashamulak Shira Bastis, or maybe Yapana Bastis, or Mustadi Yapana Bastis, or maybe in relation to Yeranda Muladi, these are the three wonder Bastis where according to the dosha predominant, maybe Vata Pitta Kapha, you can plan according to the basti of these Dashamula Kshira Basti, or maybe with Yerandamula, the Niruha Basti, and even along with Mustadi Apana Basti. These three are excellent in treating of my practical experience. I'm telling, I'll only handle with these three buses depending on permutation and combination of individual requirement. We are getting expected result. And Uttara Basti, definitely it will go in collaboration with Anuvasana Niruha and along with Uttara Basti, where it directly indication Yoni Vapat and Pushpanasha and Garbhashaya Vikaras. Definitely at three sittings in Yoga Basti schedule where Niruha Basti is there. In accordingly, we plan Uttara Bastis in the consecutive days, especially in with Kshara Taila or maybe Mahanarana Taila, where if you think like Kledatva and other things are more, maybe you feel like additions are more and other thing. Even with Saindava, a pinch of Saindana along with Taila Yoga, it will be beneficial to do the Kledahara of that tubal patency can be achieved. It all depends on the individual yukti. You can even put the slight tankana basma also. It's depending on individualistic requirement. We plan the basti prayoga and then it may be lekana or brahmana or vaitrana basti. Depending on the requirement, you can plan it. And uttara basti, as we all know, it should be given during the rutukala, like following a cycle. Immediately we can plan for her consecutive uttara bastis. So as we know, like the yoni mukha will be open. That is the one thing. And definitely how exactly the mode of action, because basti and uttara basti definitely even with tubal factors, ovarian factors, cervical factor or uterine factors, in all condition we can use it basti or uttara basti. Definitely whatever the additions are there, it releases the obstruction, and cervical pH is there, maybe it's a lipid media higher is the concentration and helps in quicker diffusion of it and helps to maintain the thickness and the quality of endometrium, especially when you plan like Uttarabasti. Even you can go with Yashtimadu Thaila Prayoga and other thing. Definitely in the proliferation of that endometrial, where non-responsive endometrium and other condition, where you can plan with Yashtimadu Thaila, it is equally, I mean, it's definitely helpful in such condition of non-responsive or the quality of endometrium. When you think of Yashtimadu, definitely help with it, and even Balataila, and helps to remove the Stroto Sangha and corrects the Artava, leading to the proper menstruation and ovulation, and also increases the hormone receptors in ovaries, leading to the proper ovulation. That is in relation to the Basti and Uttara Basti consequence. And Nasya, definitely when we think of Nasya, we usually think of Nashtartava or anovulatory cycles, where it will be, especially with anovulation, we usually talk about. But Nasya can does wonder even as a preconception care. Even our students are doing Nasya Prayoga like in anovulatory, but still as a routine of following that, simple Mahanarayana Taila will help for her achievement of just a stimulant, where luteal phase defects and other things are there. The usage during fertile period definitely help for achievement of conception and continuation of pregnancy. Not beyond, once the achievement of conception is fine, but it triggers the production of hormones and help for normalizing of the hormone levels, because it's no like through the Shringataka Maga reaches the shiras and removes the Kapha Avarana and Vikrita doshas, nourish the shiras and hypothalamus, where cribriform plate of the nasal bridge, where it triggers directly to the HPO axis and help for pituitary and pulsatile release of GnRH. That is what required, and stimulants is required, and where in turn from there LH and FSH will be follicular stimulation is required, and definitely the dominant follicles will be ripen and they're in turn helping for ovulation. This is especially in anovulatory cycle Nasya. But for my this thing, like even Nasya in the context of Pumsavana, where we can think of achievement and continuation of pregnancy and to get a desired child. Yes, that is the one thing. Shreyasi Praja context also, you can think of Nasya as a whole, not only for anovulatory cycles. And going with few cases, because with a short time I thought I had made myself a few cases, only 3 to 5 cases with explaining on each individualistic, where here is a patient of 31 years, a lady with a uterine and the ovarian factor. Yes, she is a known case of endometriotic cyst with a size of 1.5 to 2 centimeter. She operated, endometriotic cyst was operated around 3 centimeter like 2 years back. and later she tried with IVF, two IVF sittings, and she failed there. And followed by that, she ended up with once again an endometric cyst of 1.5 to 2 centimeter. And on evaluation, it came to know as she is a known case of PCOS where there will be anovulation. As a multifactorial, even from her husband's side, where husband is also around 34 years age, is like where oligospermia was there for him. And later on they with the last because they tried with IUI, they tried with a couple of time where they couldn't able to succeed, and later they came with the two IVF failure, and they reached out in last year around Feb. Okay, that is 2022. She had approached our thing where in the Jan and Feb where they couldn't able to achieve following with one Shodhana. I'm not telling like when single Shodhana they achieve, see every matters, Sattva, Daiva, everything matters. But along with that, with a consecutive 2 month cycles where we had put on both wife and husband, I had tried approach in the line of Garbhadana Samskara, where we had given a Shodhana appropriate to it, both wife and husband, where husband Falagrita has been chosen as a Snehapana, and for wife, where Mahakalyana Grita and Varunadi Grita in combination, Yamaka Sneha has been planned, and followed by that where Yashtimadu Kshira Paka has been given for a period of 1 month. Okay, 1 month she had been continuous on Yashtimadu Kshira Paka and Bala and Yashtimadu Kshira Paka throughout the cycle, and later she missed one cycle, and the next consecutive cycle it shows that she become a pregnant of 5 week pregnancy. Okay, why I'm telling is even though endometriotic cyst is there and whatever the underlying pathology, but still achievement of a conception is need of the hour, and in accordingly within 8th week of pregnancy, because within 2 months of pregnancy, labde garbe, where we had done even Vatashunga Nasya has been done for the same couple. Yes, and following that, the continuation of pregnancy was there, and now she is having a 7 month baby of a male child, a healthy baby. You know, the birth weight is around, and she followed the Garbini Paricharya of ours, and we have like Narikela Prayoga during pregnancy around third, fifth, and 7th month. The lady is continuously on Garbini Paricharya of totally on Ayurvedic parlance, even Falagrita and then Dadi Madigrita, consequence of monthly development, we had assessed her, and she given a healthy baby of a birth weight of 3.8 kg, because it's a big baby for her, but even though her profile, maybe hypertensive and the diabetic, even the pre-eclampsia profiles were normal, and she delivered a healthy baby of 3.8 kg. Of now, presently, she is having a 7 month male child. It's fit and healthy now. Okay, this is one successful story of where both the factors, where both male and female factors are contributing, where a simple Shodhana and followed by Garbini Paricharya, like Garbhadana Samskara, along with Nasya as a Pumsavana Karma, we had done it, and yes, we had achieved the success. This is a one simple example, and we have lot more such cases, but still, this is one I thought that too, after like 8 years of her married life, now she is having a one healthy progeny. Yes, this is one success rate of where uterine factor and the ovarian factor is contributing. And the next consecutive factor, like where ovarian factor, here I am discussing on ovarian cyst. Even we have like PCOD and other thing, but it's a case of like ovarian cyst with the size of here she's a size of like 3.6 to 2.9 centimeter with irregularity of cycle has been noted down. She is like now 23 years of 19th year only she got married. But the thing is, since 2 years she's trying for conception, couldn't able to achieve with irregularity of cycles, and what do you call oligomenorrhea is there, where she couldn't able to get her cycle timely. Sometimes even she get there is heavy bleeding, sometimes there is complete scanty flow, there is complete disturbance in her menstrual irregularities, and she approached our hospital for further management. And we tackled in this case once again with Virechana. Okay, first we started with Varunadigrita. We had given as a Snehapana and we had treated her. And followed by that, we had given next consecutive cycle with Basti, with Eranda Muladi Niruha Basti, a Lekana Basti has been planned. where we had given Alepadravya as Gomutra has been added in Yerandamuladi Niruha Basti. And the consequence later next cycle where Varunadi Kashaya and then Kanchanara Gugulu was given for consecutive, like definitely Gugulu definitely does Kashana. Usually I won't give for a longer time. 15 months break and 15 months like that. And Shamana Sneha with Sukumara Grita has been given on a daily basis. And now after treatment, like almost 6 months of treatment, now her scan shows normal report. This is simple right ovarian cyst. It's cleared and now she is getting her cycles timely. Okay, it's 7th in the July. It's got cleared, and in this August, yes, we are expecting her cycles, because in the past 2 months her cycles are coming in timely. Every 28, hardly 30 days, she is getting a cycle. And hopefully in next consecutive cycles I need to assess her ovulatory factor ovulation, because she is ovarian cyst was there and even unovulated cycles was persisting. I'm expecting maybe a consecutive cycle she may achieve conception. And going with one more, like ovarian, once again, because thin wall cyst, definitely of more than 5 centimeter is a surgical indication, but still, when the couples are seeking for fertility, definitely we need to think of surgical intervention minimal. We had given a try for minimum 3 months of cycle with the same line of treatment of a previous thing. But here Vamana has been planned, okay? And then later, where Panchatikta Gugulugrita and Varunadigrita has been given in combination. And then one course of Basti has been given with Dashamula, where Vata Kafahara, we were thinking of Dashamula Kshirabasti has been planned in this patient. And the consequence is she is with normal scan report after a period of 3.5 months around. Okay, and now we are expecting, since this is already in the July, in the past 3 cycles, her cycles are coming timely. Okay, this is one more case report on ovarian factor influencing on it. And definitely there are some other thing, even though it is not the direct evidence, but still the cervical factor, where in the entrance itself any difficulty, where ascending infections are there, and the chronic PID and may end up with tubal interference, both are interrelated. To tackling such cases where this is two different cases, where cervical factors has to be taken care of, where the lady with chronic cervicitis with erosion of cervix, where we treated with yonic shara with apamarga, okay, and following within a period of 7 to 8 days with a follow-up of 15 days, whereas cervix become a healthy cervix. And later she is, because even with cervicitis, she had an issue with what you call dyspareunia and other thing. To overcome that, Sthanika Chikitsa had been made, where Yoni Prakshalana with Panchavalkala Kashaya, and then Yoni Kshara with Apamarga, and followed by Yoni Pichu with Yashtimata Thaila has been kept for 7 days, 1 day of Kshara. It's only a 1 day of Kshara, and only Yoni Prakshalana and Yoni Pichu has been taken for 7 days, and where the achievement of what is called the healthy cervix is achieved. And now we are in the track of what do you call following Garbhadana Samskara for achieving her conception. And here is a tubal factor, because I didn't get a previous cases, but there is one case report of where 32 years of lady, okay, as such she is not having any PID or pelvic inflammatory diseases, but still she end up with tubal block with a period of 6 months of treatment, 6 to 8 months hardly. She had taken a treatment, even Vamana, Virechana, and Basti. All three sorts of line of treatment is given in Basti in consecutive 3 cycles. She had given 1 cycle with Mahanarayana Taila with what do you call Saindava has been triturated, and that has been given as Uttarabasti. And later we had treated in the next consecutive with Ksharataila, where consecutive of 7th month where the tubal block is cleared. And now we are still in the process of her achievement of conception is still on that process. This is a few like individual cases of ovarian factor, endometrial factor, and then cervical and the tubal factor majorly impacting the fertility. And in this regard, these are the few examples of it. And I had published a few articles, okay, like successful case report and interpretation on the review, conceptual review of PCOD or Anarthava, and successful management of recurrent pregnancy loss. This is one case I had not put, where her case like PCOD was there. Here with the recurrent pregnancy loss, I had published in the Scopus. You can go through with this reference if you're interested. Where in this patient, she had a recurrent pregnancy loss of 4 to 5 pregnancy losses. Everything is every pregnancy has lost around 2 months. Within 8th week, there is a early pregnancy loss, or she may end up with blighted ovum. But as such, there is no impairment of achievement of conception, but continuation of pregnancy was hampering. And later, like it's been 11 years of married life where she couldn't able to achieve a conception, because later, like last 2 years, she lost her all hopes, and she was there like she put on her weight and obesity, and later anovulatory was there. So following that, we given like Udvartana for a period of 6 days, and followed by Shodhana as planned, like Virechana, and then followed by Uttarabasti for 2 sittings, and then later she conceived. And as once again we planned with Mahakalyanaka was used, and even Uttarabasti Mahakalyanaka Grita was used. And later, where within 8th week, because there is every history of within Labde Garbe Api, where repeated loss of pregnancy was there, we planned with once again Vatashtrunga, we had used for Pumsavana Karma, and then later the continuation of pregnancy was there, and a proper Garbhini Paricharya was being followed. And now she's having almost like 2.5, yeah, 2.5 years, a male child presently she is having. Okay, this is the one more like recurrent pregnancy loss when all the hopes are lost, where our science does wonders. This is few articles for references which I had published, my case reports. And going further on to conclude, like modern lifestyle has led to the increased fertility issue in both male and female, and Ayurveda holistic solution restore the balancing of body, mind, and hormones through natural methods are need of the hour. And infertility is a multifactorial and reversible condition. It has increased massively in the past decade, and due to the result of combination of environmental, social, psychological, and nutritional factors, and definitely it can be conquered. Though it is a challenge for the physician, assurance and counseling plays an important role, and Ayurveda offers a personalized holistic treatment and improving the human values and creating awareness among the society regarding the marriage at proper age, conception at right time, and following a healthy lifestyle, etc. is utmost important. That's what the Garbhadana Samskara stands. Integrative approach with the diagnostic and the follow-up improves outcome, because I won't say only Ayurveda does wonders. Yes, definitely every science has its own limitation and its own flaw, but how we overcome with that, that is what required. And we should know our limitation, and at the same time we should know where excel we can do it. And for that, definitely a proper evaluation and timely intervention is key for the source or a success. And nityam itahara vihara sevi samikshakari visheshva saktaha data samaha satyaparaha kshamatvam pasevi cha bhavatyarogha, means proper following lifestyle things are need of the hour, so that we will be free from the diseases. So nowadays, whoever the couples are coming, it's I'm not telling, but still it's evident that most of them are with sedentary lifestyle, usually maybe a techno like what do you call software engineers, or many who are come and seeking for fertility. Even though out of four one is suffering, but still it's a huge number. So let the ancient wisdom guide us in restoring fertility naturally. In this regard, yes, I thank AYUSH Samriddhi, Madam Kamini Dhiman Madam, and even Dr. Pavan sir for giving me this opportunity, and my guide Dr. Gayatri Bhatt ma'am. And whatever the Gayatri Bhatt ma'am had taught me today, I am here to give a note on this. So in this regard, I only say, may every couple longing for parenthood find a hope and healing through Ayurveda. In this regard, I wholeheartedly thank the organizers of AYUSH Samriddhi for giving me an opportunity to give my insight in this regard of a perspective for infertility. I wholeheartedly thank once again for the organizer for giving me an opportunity. Thank you.
Thank you, Nanda. It was really, really excellent presentation.
Thank
You
you, ma'am.
presented very, very nicely, very confidently. You are really a very good orator.
Thank you.
Thank you so much. Yeah.
Thank you, ma'am.
Thank you so much. Now session is open for questions.
Yeah.
If anyone want to ask.
Can I stop the sharing, ma'am? So
Yeah,
that
you stop the screen share. Yeah.
yeah, thank
We
you.
will have question answer session now.
Yes.
If anybody want to ask the questions, first of all, we will take up the questions. Yeah. First of all, I would like to ask that you quoted that Vishnu Sahasranam, that was Deva Vipashre
Yes,
Chikitsa.
ma'am. One of
Right?
my junior, like
Uh,
Lakshmi Dia, she is
uh,
doing a PhD from RGHS, where she is
yeah.
claiming on normal labor and achievement of conception. One for the normal labor and even for achievement of conception infertility cases, it does. But
Uh,
she says like she's now around 5, 6 cases. She says 3 to 4 cases have been achieved conception. But how exactly I need to
Yeah,
talk
but
to her? It was
whatever will be the whatever will be the result. But I wanted to know about the protocol. What was the protocol that at what time that should be
yes, ma'am.
listened?
Just I
And
means I just
yeah,
quoted because Daiva Vipashraya and Sattva Vijaya came. Definitely, I have a note with her. If at all she's there, I would have asked her. Definitely, in the last week only, where we have a SDM Alumni Association, where we had a meeting,
okay.
she had just said, I'm still, I couldn't able to reach out her, but still I have a note with her, ma'am, and I'll get back to you.
Yeah. Because we should know that at
Mhm.
what time and then how many time
Yes,
it
ma'am.
should be listened. Yeah.
Yes, ma'am.
Some
Definitely.
as
I'll
in
get back to you, ma'am, soon, so that you can for your people like your core team, you can just share it. I'll definitely have a talk with her and I'll get back to you.
yeah, as in our previous webinar,
Yeah, definitely.
some person was also quoting that that same protocol, but that was time of I think 7 p.m. He was telling
Okay.
that
Yeah.
at
Okay.
7 p.m. it should be listened.
Mm-mm.
So, what was her protocol?
Okay,
Yeah.
definitely, ma'am. I'll get back to you. But the irrespective of that, ma'am, definitely, even though I am a Shiva, like I am the like usually I follow the god Shiva, but still, whoever come with my patients, I'll definitely say them because see, definitely I believe on Sattva Vijaya and other thing, where definitely I say them to go with Vishnu Sahasranama and even with Subramanya Ashtottara. Definitely, I advise them because above all, definitely that also supernatural power, definitely it will be there. Those two gods definitely over the infertile patient. I just guide them. It's left to their what do you call belief, their home god or whatever. But still, Subramanya usually I prefer, and even Vishnu Sahasranama.
Yeah, I
I
advise
mean
Vishnu Sahasranam
positivity.
after conception for sustain the pregnancy.
Yeah, but
That
I
I
will be
have.
like when they come for seeking for
Yeah.
fertility from the day one
Yeah.
itself, I'll advise them, ma'am. Whenever they ask me for seeking for fertility,
Yeah.
they can continue throughout pregnancy, but
Yeah.
achievement of conception usually. Yeah.
That can be advice, but generally, I have always advised as soon as the patient
Yes,
conceive,
ma'am.
I tell her,
Yeah.
listen Vishnu Sahasranam daily. To
Yes,
that
ma'am.
Vishnu is we can say that Palak.
Yes,
So
ma'am.
to sustain the pregnancy,
Sustainer of the universe.
yeah.
Mhm.
So that I have advised to my
Yes.
patients.
Yes,
There
ma'am.
is a question in chat box
Yes, ma'am.
regarding para-ovarian cyst.
Ma'am,
You
one
have quoted
second.
ovarian cyst. Yeah,
Ma'am, chat box where I can see you. Yeah, tell me,
para
ma'am. I couldn't
para
able to see that.
para-ovarian cyst.
Let me open. Ma'am, chat box I couldn't able to see it. Can you please say that, ma'am?
No problem.
One
I
second, ma'am.
have
Chat,
read
I'll
the
open it. Yeah.
yeah, I have
Say, ma'am. Stay.
the question is regarding
I'm
para-ovarian
opening.
cyst.
Ma'am, you will take the sessions up. Very good.
Nanda, how you take
Namaste,
para-ovarian
ma'am.
Namaste.
Ma'am,
How
namaste.
you understand and manage the para-ovarian system? Our question.
Okay, okay. Ma'am, frankly speaking, cyst, para-ovarian cyst, modern science, when we think of like excision, will the major thing come and definitely the estrogen dependency and other thing. But still, when I think of it's like Grantihara Chikitsa is the line of treatment. In this parlance, I had treated her like Vata Kafahara line of management and Shoshana line of treatment is required in such condition where Vaitarana Basti and even with Virechana with Varunadi or any Tiktaka Gritas for that matter will definitely help for Tikta where Tikta is show like Vata Pradhana and Shoshana of that, definitely that will help for what you call the reduction in the size of para-ovarian, because cystic collection or a fluid retention, when you think of Shoshana line of treatment, does the wonder in such condition. And for information, ma'am, I have like 13 cases ongoing now where ovarian cyst from 2 to 5 centimeter, beyond 6 centimeter I not treated. 2 to 6 centimeter, whoever I treated, I have a reference that even with Virechana and Vaitarana Basti, I had treated them with successful with previous with cyst and later with normal study. That is the thing. Only with Tiktakagrita's Virechanas and followed by Basti with Vaitarana. It has given excellent result in cystic lesions, any cystic lesion for that matter. Maybe
Yeah,
hemorrhagic,
yes, yes.
whatever, para-ovarian cyst and other thing.
Yes, rightly said. Veteran Basti is giving good result in such type of collections.
Yes, ma'am.
Yeah, cystic collections. Yeah, yeah, yes, yes, yes. Yes. Deepika, do you want to ask today? No question?
Mhm.
Yes, ma'am. Good evening, ma'am.
Good evening, ma'am.
Good evening. Hmm.
Ma'am, a very beautiful presentation, ma'am. As Kamini ma'am told, a really good orator, confident, fluent, and with a neat and very neat presentation covering everything, ma'am.
Thank
I
you, ma'am,
really
so much.
enjoyed it.
Thank you.
All the aspects, research papers, and everything, ma'am. Ma'am, I had one doubt.
Yes,
The three specific bastis, what you told, ma'am.
yes.
Mustadi Yapana
Ustadi
and
Appana, but and
Kashmir
definitely my
and
guru is there, Dr. Gayatri ma'am, but in the line. Yes, whatever we are observed, the way she treated, till date, I'm only following these three. My students usually say, ma'am, you have limited number of medicines, you won't go beyond. Now I had given my open book system where I have only three bastis, I'll tackle it. One is Dashamula Kshira Basti, Erandamuladi Niruha Basti, and then going with Mustadi Appana Basti. Now, what's your question, ma'am? Among these three bastis?
among these three bastis, ma'am,
Hmm?
I just wanted a more explanation as to some examples of each bastis as to where we can use each of these bastis.
Ma'am, definitely, like as the name only suggesting, where you want Brahmana, Lekana, and then that is what, where you want like nurturing or nourishment, like, and then where you want Shoshana, like, that all depends on baseline of Panchamahabhuta theory and then Doshik involvement. According to that, if you assess and treat it, definitely you can plan like where you want Brahmana line of treatment, go with Mustadi Appanabasti, where you want Lekana, only those things, where you want to do Karshana, Vriddhi or Kshaya. These two only should happen. Wherever you want that, accordingly you can plan. Where I want like nourishment or nurturing the such things, where dysmenorrhea with lean build and other thing, it all depends on individual understanding. But still, my interpretation goes like that. Where I want like nourishment thing, then I'll go with Mustadi Appanabasti. Where I don't want to go with Lekana, where fibroid uterus and other thing, usually I'll go with Lekana type of Basti with Erandamuladi. And then where I'm bit confused, where which one to choose, where Vata or Kapha, then I'm Vata Kafara, where I'll go with Dashamula Kshira Basti. This is how I approach and mix and match, and I'll just do it accordingly.
yes, ma'am. In
So
Dashmul
Dashmula,
Kshira Bhakti.
yeah,
Yes, ma'am.
that was also my question. Dashmul Khirabasti, how many days and in which dose you are giving?
Ma'am, Yoga Basti pattern like Yoga Ratnakara, like Madhyama Matra, I usually give that. Niruha Basti. Dashamula Kshira Basti as Niruha, maybe Anuvasana, you can take it any Vatara Taila, maybe Sacharadi, Mahanarayana or Danvantara. It's left to your individualistic opinion, you can adopt accordingly.
Ma'am, what is the kalka used there, ma'am? Any idea?
Where?
In Dashmul Kshir Basti for
Ma'am, even
kalka,
you can
which are the
use like
drugs?
generally you don't have any like Puta Yavani, you can take it, or you can go with Shatapushpa or Kalka. You can once again make a mix and match. Maybe you can use Guduchi or Tikta you want more, or even you can use Shatapushpa, Shatavari, or even Trifala you can use it. It all depends. Like Kalka, it is individualistic, ma'am, but usually I'll go with if I don't know anything, then I'll go with Puta Yavani. It's indicated that in general, any bastis you can use that as baseline Kalka Dravya.
Okay, ma'am. Ma'am,
Yeah.
just as you told, ma'am, that confusion aspect, ma'am, like I have a case
Hmm.
whom she had one tube operated due to rupture, ectopic rupture, and the other one, she got open abdomen, she got it repaired with fine thread, and the doctor has said, I've preserved your tube, and she has done a HSG after that also, and the tubes are patent after the surgery.
Good.
So, but her endometrium, ma'am, in the 20th day of cycle is 3.9 mm.
Not good.
And yeah, otherwise uterus is normal. All the time it is showing thin endometrium. But ectopic, this is there, ma'am. So for such cases, and basically she was Montauk's positive was a TB Gold Plus positive test. So she's taken that 9 months treatment and she completed it in 24. Then she went for IVF because doctors told not to try again for normal because she had two ectopic. She went to yeah, after this she went to IVF this one, and they did the plasma treatment even for increasing the endometrium, but there was no much improvement. After that, only on the 20th day when they saw it was 3.9 mm, they gave a 20% success rate. That's why she denied for the IVF. So now she's again come back to me, ma'am. So I am, and but her cycles are scanty.
Yes.
Initially, it
Can
was
tell
two,
you-
three
I
pads,
don't. Okay.
2-3 pads per cycle.
Yeah.
And from the last 2 cycles, it's just spotting. 1 day spotting. So now, exactly like how do we go? This is like Brahmana line of treatment should be given for the endometrium, no, ma'am?
Frankly speaking, can I say like we have our own limitation? That's what I said in my conclusion. Definitely, you wouldn't have said the cox, abdominal cox, or maybe like I don't know, tubercular origin. What exactly? My Gayatri ma'am also is there on the line, but still, what my interpretation is, I had one case of abdominal cox where my limitation is there. I couldn't give in to her. I had advised her to go with IVF. But the thing is, only endometrial thickness is not there. Where secretory phase, and the proliferative and the secretory phase, where estrogen, phytoestrogenic like Shatavari, Grita Uttarabastis, or maybe Yashti Madhu Grita, like Yashti Madhu Taila, you can do the thing and you can try with it. And where you can put all the like ovarian stimulation, where steroidogenesis to happen, where estrogen and progesterone to be there to for proper what you call endometrial thickness to raise. So keeping that line, you can treat it, but still with a limitation with abdominal cox. I don't know, like what is the tuberculosis
No,
of
ma'am. She has taken the 9 months treatment and she's
whatever,
repeated
ma'am.
the
It is
test.
like
She has
impact.
repeated
It's
the
like
test also.
once the impact, definitely that will. I don't know, like the damage will be there. If I request, if I'm not wrong, I request my guide, Dr. Gayatri ma'am. That is a case where definitely some sort of limitations will be there, right?
Yeah. So whenever cox abdomen is there, so usually there will be adhesions. So due to that, the tube may not be blocked from inside lumen, but because of the adhesions, there will be compression on the tube. So tubal block might have been there because of the compression. Okay, and that's why actually the consumption is difficult. And thinning is there, endometrial biopsy is needed to know again want to understand tubercular endometritis. Okay,
No, ma'am.
and if
Post
wrong, if we, because I had one case very surprisingly she conceived actually rejected by everyone, married life 13 years, both the tube block and cox abdomen history. And there in IVF center also they said this even for hysteroscopy also they refused, and laparoscopy they free because cox abdomen usually there will be severe adhesions will be there. So it's very better not to try anything. So you adopt like that. So even she had taken all the treatment, the anti-tubercular treatment also she had completed. Then we gave her Virechana, repeated Virechana after one in the gap of 3 months. Then Uttarabasti also we had given, but I had told her it's not real block. It is because of the compression. But adhesions can be understood as Vataja, Karaguna of Vata, Ruksha and Karaguna of Vata, thinking that. So actually, I gave her Indukanta Ghrita every day early morning as a Shamana Sneha 5 ml with milk. Then actually her sister-in-law was my patient. She had 2 normal delivery with me. She had referred this her to me. So after that, also she was not conceiving. Then I told her to continue with this, and we'll try. But even I also better. I also suggest you to go for adoption. This you have to accept the truth. Like that I gave her all the counseling was done. Then I said, after 6 months, her sister-in-law calling me and telling, "Ma'am, my sister-in-law is conceived, and now she is 3 months amenorrhea." Then I told it may not be because it may not be pregnancy. Please get the scan done. She said, no, scanning was also done. NT scan, everything is fine. Another the baby is, I mean, that her son is 10 years old. So this is, I was on the surprise. And because this Asan is very small town, I talked to that IVF center gynecologist also. I reported her about this case. So your case, this is what the situation was there. The rejected case, but she conceived, and she was also told, even very, it is a miracle. Maybe her luck was good because very difficult. Whenever we get Cox abdomen history, conception is very difficult. So that's why IVF they say. Okay, I hope you understand. And
Yes,
for
ma'am. Ma'am,
if suppose your patient was not having the history of Cox abdomen, even salpingectomy due to history of ectopic, one tube is fine, but endometrial thickness is very less, thinning ಇದೆ, then we can understand that Shravrupi Artava Kshaya. In Artava Kshaya line of management, we can plan. As Dr. Nanda very well said, whether it is due to what you call whether the Artava production is the problem, Utpatti, that Rasadhatu, Upadhatu. Artava production is problem due to how to say Agni Mandya, or due to Dhatu Kshaya it is happening. So why the thinning? So we have to analyze in that level. Then you can treat. You can, in such case, Artava Kshaya, we can give Vamana. Then after that, you can give Brahmanavasti, and also you can give her Uttarabasti with Falasarpi. Or as he said, Estimadu, Taila Sarpi. Phala Sarpi actually nice, good. Even the Akshirabala Taila also you can give Basti, Uttara Basti, 3 cycles, the 3 days. So, and internally, again, we have to give Falagrita, Kshirabala, 101, like that. And in such cases, it will improve the endometrial thickness. In many a times, even the modern science also, they have not seen any estrogen. It's not visible, estrogen or progesterone, that coming, FSH, LH, polyphenol. But they understand by looking at the changes. Just like that, we also should understand this Vata, Pitta, Kapha. Even we cannot see, but it's because of the the processing happening there, right? We can understand its functions. I hope you understand what I want to convey,
yes,
right?
ma'am. Yes, ma'am. I
So
got
you
it.
don't worry, we need not to compare. See, when I was young and started practicing and all, even I used to compare the the reports, and I used to treat, oh, endometriosis we treat, PCOS we treat. Now as clinical experience is there, by treating several cases and by teaching also. When students teach a lot to us by asking questions, by clearing their doubts, by discussing different cases and all. Nowadays, since many years, I am not at all getting any test done. I won't write any test to my patients. Only scan I do and HSG if needed. Otherwise, no blood test, no investigations. Because we have to analyze the Vata, Pitta, Kapha, and Vandyatva is due to Vataja, okay, and treat Vata, and it is Basti Sadhya, okay. And another reference says that Artava Srotos with the Lakshana, there it is told about the that Vandyatva. See here, Vidya we can understand. Vidya is injury. Injury could be due to surgical or some any trauma, or injury could be due to some organism also. So this Cox abdomen, due to that infection, that might have caused the injury to the Artava Srotas. That's why Artava formation is affected there. That's why she's not conceiving. Okay. Or sometimes Asherman syndromes also. There also Arthavava with the luck, due to that also there will be amenorrhea or infertility. So sometimes rejected case also gives good result with our concept actually. Just to think of Vata Pitta Kapha. But if her age is advanced age, then better you convince her and go for give on the 2 to 3 the bastis after virechana. You give every month basti. Okay, then ask her to go for IVF if not conceiving.
Yes, ma'am. Ma'am,
And also
actually,
asadhya rogas are told in our science and should not be taken asadhya roga. Otherwise, we will be defamed. That's also our science says, right?
yes, ma'am.
The truth
Ma'am,
is truth.
actually,
Ah.
after the post-tubercular treatment, her DNC was done, and the biopsy report says just
Normal.
shredding secretory endometrium.
Then
So
good
there was
only. You can
no
treat her
findings
with the
as such. And
okay.
after that, TB Gold Plus also was repeated, which showed negative.
Okay,
So,
then
and
okay.
then moreover, she's a Muslim patient, ma'am. And there is some emotional touch with this
Yes,
because of
definitely.
the thing, like if you usually they start speaking of second marriage in the
Yes,
family.
Yes,
yes.
ma'am,
So
definitely in
initially
this
she is
figure,
very
In all,
dependent on,
not only
because
Muslim, everything it is there.
it's the need.
So
but
you
more
see,
commonly in their this one actually. So that's why emotionally she was totally out when she came to me. I brought her up by
yes,
repeated counseling. I brought her this one up and made her enthusiastic for treatment. She was very this one, and then I referred her when she had TB and all, and then she came back to me and all, and only with our medicine she conceived, ma'am. For 7 years,
okay,
she was infertile. I
yeah,
had given her this Oruveran Kshirpaka.
okay, good.
That Bandira
That's
wala.
fine.
With that
Yeah.
only 2 times she conceived, but it turned out to be ectopic. Otherwise, she had never any this of